Welcome to the deep dive. Okay, so today we're ready to plunge into a stack of your sources, really focusing on a condition that, well, it gets talked about a lot and seems often misunderstood. Fibromyalgia.
Yeah, and these sources you've shared, they present a really a clear perspective on what they see as the central puzzle of fibromyalgia. It's quite fascinating.
It really is. And the hook, the core challenge these sources lay out almost immediately is this reality of widespread body pain. Pain that people genuinely feel, intensely even, but which has absolutely no visible physical signs.
Right.
Nothing shows up on x-rays, nothing on blood tests, no structural issue you can point to on a standard scan.
And that lack of, let's say, physical proof is exactly why the sources highlight this really unfortunate tendency for people feeling this real pain to sometimes be told, it's only psychological.
Which they push back against.
They push back hard because, as you can imagine, that's incredibly invalidating when you're dealing with debilitating pain, fatigue.
Absolutely. So our mission for this deep dive, using only your material here, is to unpack what fibromyalgia is according to these specific sources, figure out how they say it's diagnosed despite those negative tests, and then, maybe most compellingly, explore their perspective on potential causes.
Yeah, especially that focus on the connection, the really deep, intricate link these sources describe between the physical symptoms and emotional or psychological factors.
We need to see how diagnosis even happens without the usual tests, right?
Yeah.
And what specific kinds of events the sources talk about as potential triggers.
And really get into why they argue so strongly that the brain and body are, well, basically one unit in this context.
Okay, let's start with the basics then, as these sources present them. Fundamentally, what is fibromyalgia according to this material?
So they define it as a complex pathology. The main thing is this widespread pain throughout the body. But the critical part, like we just said, is this absence of visible physical signs.
Right, no visible inflammation or damage.
Exactly. So while the symptoms are absolutely felt physically, the sources argue pretty strongly that it's a physical pathology, but with significant psychosomatic and emotional aspects tied to its origin.
Yeah.
They're very clear. It's not just psychological.
So a real physical manifestation.
A real physical manifestation, they argue, rooted in something deeper, often non-physical initially.
Okay, so the pain is physical, felt in the body. But the trigger, or maybe the root cause, is often presented as being linked to emotional states or events.
That's the connection they draw.
Which leads us straight into the diagnostic challenge. Because the sources describe well, frankly, a pretty frustrating journey for people trying to get diagnosed, don't they?
Oh, absolutely. The experience they detail is, visiting specialists after specialists, traumatologists, physiatrists, rheumatologists, undergoing just countless tests.
Radiography, resonance scans, tomography.
All the blood tests. And the outcome they describe. Consistently the same. The tests come back showing, quote, nothing.
I mean, it makes perfect sense why someone going through that would feel completely lost or misunderstood or even start questioning themselves.
Precisely. And the sources are really emphatic on this. Fibromyalgia is not diagnosed through those kinds of tests. According to this material, the diagnosis relies on something they call semiologia.
Okay, semiologia. Can you break that down a bit? What does that mean in the way the sources are using it here?
Yeah, it basically refers to clinical analysis. So, think a thorough physical examination combined with the patient's detailed history, their symptoms, their medical background.
So it's more about the clinician's skill and observation.
Exactly. Skilled observation, interaction with the patient, often involving checking for specific tender points. The sources mention these are key, though they don't list the exact number here.
Uh-huh.
And a major critique in these sources is that many medical professionals, in their view, fail to properly connect the brain and body as this single unit they keep talking about.
Which leads them to miss what's really going on.
That's the argument. And they say this often results in just prescribing things like anti-inflammatories, analgesics, or maybe antidepressants, anxiolytics, which the sources claim only mask the pain temporarily.
And might even cause other problems.
Yeah, they use the term intoxicate the organism, potentially creating this kind of vicious cycle instead of addressing the root cause.
That emphasis on the brain-body connection, it really feels like the absolute core of this source's perspectives, not one or the other, mind or body.
No, it's a fundamental link. That's the core message, definitely. And because of this elusive nature, the physical symptoms without the visible damage, the sources use some pretty descriptive terms.
Right, they call it a very deceptive pathology, or, I thought this was memorable, the ghost disease.
The ghost disease, yeah. Because it's felt so intensely, yet it's invisible to standard medical tech. They also clarify its medical classification. It's seen as a type of rheumatism, but importantly, a non-deforming one.
Meaning it doesn't cause physical changes like arthritis might.
Exactly. Unlike rheumatoid arthritis or psoriasis, where you might see, visible joint changes or skin issues, fibromyalgia, from this specific viewpoint, doesn't cause that kind of physical deformation.
Okay, so this leads us into what feels like the most maybe unique and emphasized part of these sources, their perspective on the potential causes. They state it pretty clearly, don't they?
They do. They say that in the vast majority of cases they see, fibromyalgia is generated through a psychosomatic emotional trigger.
That's presented as the main pathway.
The predominant one, yes. Now, they do give a brief mention to a congenital or genetic aspect. We inherit traits and all that. But the speaker in the source immediately qualifies it.
How so?
They say, basically, based on their extensive clinical experience treating patients, they just don't believe it's significantly hereditary or genetic. Their focus, based on what they've observed, is clearly elsewhere.
Interesting. And do they give us any stats on who tends to be affected?
Yes, the sources indicate it affects roughly 80% more women than men. That's a significant difference.
80%? Wow.
And they've also noticed the age range for diagnosis seems to be widening. It used to be thought of as primarily maybe 30 to 50 years old, but now they're seeing diagnoses from age 20 all the way up to 60.
Let's really drill down on this idea of the triggering event then. When the sources talk about trauma as a trigger, what exactly do they mean? It sounds broader than just, say, a physical injury.
Oh, much broader. They define trauma generally as any external event that causes some kind of damage. That could be an accident, sure, but also a difficult life situation, or even a major fight or conflict.
Okay.
And while it can stem from a physical trauma, like a traffic accident, a fall, a blow, they immediately pivot to how even those physical events often have really significant psychological consequences.
Right.
Well, the example they use is chronic physical pain itself, potentially leading to something like depression.
Which brings us right back again to that brain-body connection.
Exactly. And this is like the bedrock principle presented in these sources. They state it very directly. The brain and body function as a single, indivisible unit. There's a direct connection.
So just like physical problems can mess with your psyche.
Right, like the chronic pain causing depression example.
The reverse is presented as equally true and maybe even central to fibromyalgia.
That's precisely their argument. Any significant psychosomatic, psychological, or psycho-emotional problem, any trauma affecting the psyche will, they use the word repercutir, it will impact the body.
The two-way street.
The definite two-way street. And in the case of fibromyalgia, the sources argue the impact on the psyche is often the starting point for the physical symptoms.
Do they give specific examples? What kind of psycho-emotional traumas do they see as these primary triggers?
Yes, they list several key types that they've apparently identified through their clinical work. One major category is loss, the death of someone very close, like child, parent, spouse, even a close friend.
Okay.
Another big one is deception. Things like infidelity, the loss of love, a painful separation. Illness is also on the list.
Your own illness or someone else's?
Both, actually. Either experiencing a severe illness yourself in the past and having this lingering fear it might come back, or the serious illness of someone very close to you.
Yeah.
And finally, they highlight subjugation, or sometimiento is the term they use, which they define as abuse specifically mentioning sexual abuse or abuse of authority by someone like a parent or a spouse.
And they mention this affects women more, but not exclusively.
Exactly. They note again that while these types of events are seen more frequently affecting women in their practice, they have definitely observed them as triggers in men too.
It really sounds like the individual's response to the event is maybe just as important as the event itself.
That's a crucial point they make. They explicitly state that the impact of any traumatic event varies enormously. It depends on the individual's temperament, their character, their life history, and especially, they mention, their sensitivity.
Sensitivity.
Yeah.
So it suggests that maybe susceptibility to fibromyalgia could be linked to how sensitive a person is.
That's the suggestion, yes. That it might affect individuals differently based on their level of sensitivity to these kinds of events.
Okay, now here's where the sources theory gets really specific, and I have to say, quite unexpected. They talk about a particular timeline between the emotional trigger and when the symptoms actually start.
Yes, this is probably one of the most surprising details in these sources. They suggest a typical pattern where, say, an emotional trauma occurs, and then approximately 1 to 1.5 years later, the fibromyalgia symptoms begin to appear.
Wait, a year? Or even a year and a half after the event?
Oh,
That's not
yeah.
intuitive. Why such a delay? What's their explanation for that specific time frame?
It's a bit unusual. Their theory seems linked to what they describe as sort of how humans work in cycles, like annual cycles, the rhythm of years in history, that kind of idea.
Mm.
Their hypothesis is that the brain starts to prepare for a potential catastrophe, maybe a recurrence of the event, around the anniversary of the original trauma.
So the brain and body are bracing themselves for something that happened in the past, almost anticipating it might happen again.
That seems to be the mechanism they're proposing, this preparation, or they use the term sobredimensionamiento.
Overdimensioning, like an over-preparation.
Exactly. This over-preparation causes the body to go into this state of defense against what they call a phantom threat, something that did happen but isn't currently happening. Yet the fear or the memory drives this defensive response.
Right. But how does that internal defense translate into the actual physical symptoms, like the widespread pain? What's the connection there?
Well, according to these sources, this defense mechanism, this over-preparation state, leads to the generation and then the inflammation of a large number of pain receptors.
Pain receptors.
Yes, and they're specific, again, mentioning this happens at 18 particular points in the body. The result is this state of intense hypersensitivity.
Ah, so the pain isn't necessarily coming from ongoing physical damage or injury in the tissues,
Not in the conventional sense, no.
but from these pain receptors themselves becoming hyperreactive and essentially generating pain signals.
That's the model they present. These hypersensitive receptors create a kind of feedback loop, generating perceived pain. They describe it as pain that doesn't exist by inflammation, meaning it's not caused by typical physical damage inflammation, but by the receptors themselves being overly sensitive, firing off pain signals.
Okay, that makes sense within their model.
And they also make another crucial link. They note that this whole process, generating these receptors, feeding this defensive state, it uses up a significant amount of energy.
Ah, okay, and there's the connection to another major symptom, right?
Exactly. This significant energy drain required for this internal defense and the whole pain receptor process is linked directly by the sources to the symptom of chronic fatigue.
Which is often debilitating for people with fibromyalgia.
Absolutely. So it ties the pain and the fatigue together through this proposed mechanism.
It's a remarkably, well, cohesive model they present, even if it's unconventional. It links a specific type of trigger, psycho-emotional, to a timeline, and then to a physiological mechanism involving the nervous system and these pain receptors.
Yes, it's quite a complete picture from their perspective. And they conclude by reinforcing how important they believe it is to recognize and understand these psychosomatic or emotional triggers.
And how does that inform treatment, according to them?
Well, they advocate for treatment approaches that work with this understanding. And they specifically state a preference for natural methods. They seem wary of conventional medication, believing it often just masks symptoms.
Right, the intoxicating the organism idea again.
Exactly. They feel it can have negative effects and doesn't get to the root as they see it.
So if we pull back and look at the whole picture presented in your sources, what's the main takeaway message here?
I think the sources offer a really powerful argument for viewing fibromyalgia not just as some mysterious, purely physical problem, but as a physical condition, yes, but one with its roots deeply, deeply intertwined with the individual's psycho-emotional history.
And that fundamental connection between the mind and the body.
Precisely.
Yeah.
That mind-body unity is central to their entire explanation.
Okay. So we've taken quite a deep dive into your sources on fibromyalgia. We've looked at the challenges of its sort of invisible nature and how it's diagnosed through clinical signs, not tests. We've understood the ghost disease label. And we've really explored this compelling perspective they present on the central role of psycho-emotional trauma and the brain-body connection in its cause and manifestation,
Right.
including that specific timeline and the proposed mechanism with the pain receptors.
It's a very distinct viewpoint. So after unpacking all of that from these sources, what really stands out most strongly for you, the listener, what new questions does this particular perspective on fibromyalgia raise for you?
And maybe here's a final thought stemming directly from this material for you to ponder. Given the source's really strong emphasis on specific psycho-emotional traumas, potentially triggering physical symptoms like pain and fatigue, through mechanisms like increased pain receptor sensitivity, what might this suggest about the potential power, or at least the potential role, of therapeutic approaches?
Approaches that focus specifically on what?
Approaches that focus specifically on processing or healing those emotional wounds or past traumas. Could focusing there, as these sources imply, be a way to potentially influence or even alleviate chronic physical conditions that might be rooted in this kind of mind-body connection they describe?
That's a truly significant question that comes right out of this material, isn't it?
Something to think about. That concludes this deep dive.